Q&A. If you have questions throughout that you'd like to ask our speaker, just go ahead and put them in the chat. And what I will do is scroll the chat when the talk is done so that we can get your questions answered as we go forward. But I will now go ahead and introduce our speaker. Dr. Ali Rowhani-Rahbar is the Bartley Dobb Associate Professor for the Study and Prevention of Violence and Associate Professor of Epidemiology at the University of Washington. He is the co-director of the Firearm Injury and Policy Research Program, leader of the Violence Prevention Section, and director of the Research Core at Harborview Injury Prevention and Research Center. The overarching goal of his research is to inform programs, practices, and policies that prevent the occurrence, reduce the lethality, and stop the recurrence of interpersonal violence and self-directed harm. His epidemiologic studies have spanned across multiple forms of violence with a specific focus on firearm-related injury and crime. And with that, I will step aside and leave it to our speaker.
Thank you very much. Mike, please let me know all if there are any technical glitches or you can't hear me well, and any other internet-related issues. I'm delighted to be here. Thank you, Michelle. Thank you, Mike, and all the colleagues at Rutgers. I wanted to talk to you about this topic because I think for all of us, its timeliness is very clear. And some of you actually at the center over there have worked in some of these. And I thought it would be great to talk to you all about some of the work that we have done and brainstorm about how to move forward. The work I'm going to be presenting is a small part of my presentation. It's not all the parts of the presentation because, as I said, the goal is to really brainstorm and think about ways to move forward in this area of research. But this specific work was funded by the state of Washington. As you probably know, Washington state became the third state after California and New Jersey, actually over there, to really devote funds specifically for firearm injury and gun violence research. And the work I'm going to be presenting was funded by the state of Washington. We have received funding from other funders and funding institutions for work outside the one I'm going to be presenting today. So this is the outline of my presentation. I talked to Michelle earlier. I think I'm going to talk for about 35-40 minutes and then leave enough time for Q&A. I think for the majority of people who are joining us today, maybe the first bullet point is very clear. But I just wanted to make sure that we are going to be on the same page in terms of the scope of firearm injury and violent crime in the US. And I do talk about injury and crime both because the intersectionality of public health and criminal justice system and epidemiology and criminology, those are very, very vividly present in everything we do in all of our work. I'll talk a little bit about the idea of how many firearms we have in this country, the stock of firearms in our country, as a segue to talk about firearm purchase in relation to some salient and particular events, and then talking about firearm purchase and storage, especially during the COVID pandemic, and talk about an example of a survey that our group conducted a few months back. I'll end with some thoughts about implications for firearm injury and safety, and then some future opportunities for work in this, which at that point I think will be a good time to actually open it up for questions and discussions and brainstorming. So to start about the scope of firearm injury globally and also in the United States, many of you may have seen the work by IHME. These days, IHME is always in the news because of COVID, as you know, and mortality due to COVID. But IHME does global burden of disease, GBD. As many of you know, they usually publish their studies in Lancet, and some of them in JAMA. They did publish a study on global mortality from firearms. And as you can see, there are 6 nations, 6 countries around the world that account for about half of all firearm death in the world, and we are number 2. Those numbers, 37,200, that's in 2016, which is when this study essentially, that was the latest follow-up time, the most recent data set that data point that they have for that paper. That number has increased, as many of you are aware, in the past couple of years in the United States. And of course, compared to high-income countries, United States stand out very, very clearly, but I'm sure you all know about that. I like this figure in JAMA because it really highlights what we were talking about. So those were absolute counts. When you put them, when you present them, display them in the context of a rate, you see the numbers here. The y-axis is the age standardized rates for suicide by firearm per 100,000 population, and the x-axis is for firearm homicide. And you can see that the dotted line, the vertical dotted line, is for suicide, for homicide. That's a rate of about 1 per 100,000. And you can see the dotted line that's horizontal is for suicide for a rate of about 0.72 per 100,000. And that's the median. And you can see that, you know, upper right corner is where those are countries that have both high firearm suicide and firearm homicide rates. And while our firearm suicide rate is not as high as certain countries, or our firearm homicide rate is not as high as certain countries, you can see clearly that the United States sort of pictorially here is placed in this diagonal, if you will, from this, which really highlights that we have both high firearm suicide and firearm homicide. And this is something that has been a big public health and public safety problem for our country for a long, long time. So that's just fatality. Obviously, in this time in our research and advocacy and practice, we constantly talk about the importance of not forgetting about non-fatal events and non-fatal injuries. We really don't have great data for non-fatal firearm injuries, as you all know. It's a contentious issue. It's a controversial issue. There used to be some data that people used all the time in their research, but there have been several publications really questioning the validity of some of the data that we have on non-fatal firearm injuries. The best estimates, I would say, range something between 1.5 to 2 times greater than the number of deaths. So roughly speaking, if you're talking about 40,000 deaths due to firearms collectively in this country, non-fatal firearm injuries or shootings that don't result in death would be something maybe between 70,000, 80,000, 100,000. The exact number is to be debated. And then obviously there is the whole element of crime in criminology. There's some work by the FBI and UCR and NCBS, National Crime Victimization Survey, that I'm sure you're all aware of, that estimates roughly about 480,000, about 500,000 non-fatal violent crime victimization in the United States each year. So we're talking about a big, big, big problem. Our colleagues at Harvard and Northeastern University, Dave Israel, Matt Miller, published a really nice paper based on National Firearm Survey some years ago that really depicted the stock and flow of US firearms. On the left-hand side, you see a distribution by type of firearm. On the right-hand side, you see the pictorial representation of the quantification of the stock of firearms in the country. So the y-axis is cumulative percentage of stock. The x-axis is the cumulative percentage of owners, and these are color-coded. So blue, for example, is number of guns 1 to 10. And then the number, this crescendo, shows the, you know, how we reach to cumulative percentage of 100% on both y-axis and x-axis. And you can see, for example, here, this dot, number of guns is 10, owners is 92%, and stock is 61%. So that means about 92% of gun owners with up to 10 guns, they constitute about 61% of the stock, the full stock of all firearms in the United States, which means about 8% of owners account for about 39% of all the stock of firearms that we have in this country. And those are individuals who have more than 10 guns. So really powerful data in that it shows the distribution of the number of firearms by certain proportion of individuals in the United States. So we talked about the fact that we have large rates or great rates of firearm homicide and firearm suicide and injury and mortality. We talked about the incredible number of firearms that we have in this country, anywhere ranging from 270 million firearms to about 350 million firearms. Again, different papers, different estimates. They slightly differ, but a range from 270 million to 350 million is a safe range. It's a wide range, but different surveys, as you know, they have provided different estimates. So both of them are issues that we have to think about. At the same time, firearm purchase does vary in relation to salient events. In relation to mass shootings like Sandy Hook, I'm sure many of you have heard about that. In relation to elections, in relation to political events, in relation to the economy and changes in the economy like recession, those things do affect and exert an influence on purchase of firearms. Our good colleagues at UPenn, Doug Wiebe and others published a paper in JAMA Network Open a while ago where they looked at these fluctuations in a number of background checks as a proxy for firearm purchase. It's not perfect. There are limitations to that, but it is a proxy to guess what are the number of firearms purchased in each state. And you can actually easily see this if you just Google it or go to the website. You can see based on background checks. You can see in your state how the numbers have changed. For example, I can tell you that in Washington state, the numbers have dramatically increased after COVID. So you see these fluctuations. Sometimes in relation to some of these events, you see an increase in firearm purchase. Sometimes you see a decrease in firearm purchase. It's a little bit of a complex picture. It's not always consistent, but it does show that some of these do act as a trigger, if you will, or as a determinant of a quick and abrupt and swift change in the purchase of firearms. Now, one of them is the economy, obviously, a big factor. So let's turn the clock back and go back to during the recession back in 2008 and 2009. There were many articles at that time that they came out that they talk about the issues of spikes and boom in gun sales that was fueled by politics and the economy. This quote, for example, from one of the owners of a shotgun: "The economy played a large part in my decision. When people don't have jobs, they might go breaking into people's home. I want to be safe in my home." And the same rationale and the same thinking is also prevailing these days. When you think about COVID-19, and many of you might be involved in work in COVID-19 directly or indirectly related to firearm injury or completely unrelated to firearm injury, you will appreciate that some of these factors are stressors that you could put on any causal pathway from the pandemic to firearm injury and crime. This is by no means complete. I'm just providing some examples for you all. You may have tens of more of these that could be a stressor or be conceived as something on the causal pathway from COVID-19 and firearm injuries. If you think about the four different principal chief intents for injury that we work on in injury and violence research, which is intentional interpersonal or assault, intentional self-directed or suicide attempt or suicide, unintentional, and legal intervention. I'm sure you all can think about scenarios by which the pandemic could cause an elevation in risk of all of these four different types of injury. The 11-year-old boy who died just, I think, a few days ago while on a Zoom class in the Sacramento area. I think there's still debate whether it was suicide or truly unintentional. I'm not sure. But that's an example right there for you, a real world tragic example of probably the pandemic had some sort of effect, causal relationship with that. It's hard to say based on one case to generalize, but you could appreciate that, for example, children and youth are spending more time indoors. If that is coupled with the greater presence of firearms, you can imagine that, a pathway right there for increasing both suicide and unintentional injuries. That is coupled with, mental health stressors, loneliness, lack of socialization. It's all that other factors that you could think about. the distancing itself, for example, or the strain, the financial strain that's on different social services could have an impact on interpersonal violence as well. We work and discuss many of these issues with our colleagues in hospital-based violence intervention program, those who are leaders. In our communities, sometimes we work with individuals who have been victims of gun violence. And if you pull away from them, many of them young men, if you pull away from them as you were providing them with housing and employment and different trainings, if you pull away from them, it's conceivable that the rates of assault will go up again. So, and the same for legal intervention and police-related or officer-involved shootings. And the social justice uprising and all that you have seen has unfolded in 2020. So it's actually not difficult at all to think about mechanisms by which the pandemic may result in elevation of any type of firearm injury of any intent. So in 2020, which is the right-hand side panel, it's been a dramatic year. It's been a tragic year. I think we all know lots of things have been happening. And so you could imagine that firearm sales also probably have been fluctuated correspondingly. Now, historically, we have examples like Sandy Hook, the election of President Obama, San Bernardino, et cetera, that really have increased the sales of firearms. But COVID-19 really has been, the pandemic and social unrest really has been a major driver in increase in firearm purchase. Now, the state of evidence about the intersection of the pandemic and firearm injury is slim. Not enough time has passed. These are just some examples that I have provided from the literature. I don't think there are too many more. There are, I think, 7 or 8 or 9. There are a combination of commentaries, some empiric work, like the one that our colleague Garen Wintemew's group did on the left-hand side that I think some of you may have read it. It's available freely. And some predictions like the one you see in the bottom in terms of what may happen to our country, well, to the world, but here in the United States and the specific context that we have, the unique situation that we have in terms of firearms, both in terms of the number of them, but also the constitutionality of firearm ownership. And I think future will tell, but at the same time, we have a lot of opportunities to actually work on these and see what empirically we can show. There are some commentaries, as I said, about how things may change, not only in terms of ownership, but also in terms of storage. But based on my own experience, my own research, we know far less about storage practices and how they change in relation to salient events compared to purchase practices. So we know we really need to improve our understanding of how the storage may change. In relation to salient events, different events, that really the state of knowledge on that is very slim, in my opinion. But COVID-19 provides one opportunity to look at storage in relation to one of those events, which is the pandemic. Just recently, I think Dr. Anestis and their group published this really nice study in American Journal of Preventive Medicine. Mike and his colleagues, as you know, have done lots of research using survey methodology in different contexts for both purchase and storage. But this one really was about suicidal ideation among individuals who had purchased firearms during the COVID-19 pandemic. And I believe they fielded the survey in late June, early July. And they did this work and showed that there seems to be some suggestion of, a particular features or characteristics of individuals who have bought firearms during COVID-19, some concern about suicidal ideation among them. The storage practices seem to be a little bit mixed, not very clear about whether they're all improving or not improving their storage practices, that to be determined. But it's a very nice paper that just came out and I had the pleasure of reading it recently. So just before this nice work by Mike and their team, Vivian Lyons, who is one of our postdoctoral fellow at the center, she is a postdoctoral fellow for the National Institutes of Health, NICHD. We are part of a consortium called FACTS Consortium, which is concerned with pediatric firearm injuries, and Vivian is a postdoc in that consortium. So what Vivian did and our team was to do a survey in early May to better understand motivations behind purchase and storage of firearms during the COVID-19 pandemic. This is an entirely hypothesis generating exercise. So today I'm not going to talk about any fancy statistical analyses or inferential designs. This is a survey to really generate some ideas about this seems to be a suggestion of something we need to work on. And I will provide you with some simple tables of percentages to hopefully set that up. But the work really was one of the first ones to look at this. The importance of the timing of these surveys in 2020 cannot be overemphasized. Because of the nature of this year, there are many other salient events that you could put on this arrow, which I haven't put. I just very broadly, I have depicted this here. But you could imagine, depending on when you actually fielded the survey during this timeline, your results may tell you different things. We fielded the survey just a couple of weeks before the murder of Mr. Floyd and the subsequent social justice uprising. So we were thinking at that point, obviously we didn't know, but so we were really just focused on COVID and COVID-19. And did you purchase your firearm in relation to or because of COVID-19 or concerns about that? That was like the essence of what we were trying to do. Of course, if you fielded later, then there are other things happening. And Mike and his colleagues actually very nicely then clearly explain this in their paper as well. And then the question is, well, when you talk about firearm purchase, what is your start date? Do you ask them since shelter in place? Do you ask them since you were concerned about COVID? What time do you start asking them, when did you get your gun? And for us, we had a lot of debate internally with our team, and we stuck with January 1st because we felt like by that time some people knew about it, and maybe it's just a sharper start date, and we're going to ask them whether you actually purchased it because of concern due to COVID. So hopefully that will be clarified. But again, it's up to debates about what would be really a perfect start date for something like that. We oversampled specifically these groups, 200 in each of them. That was the target goal. This was using MTurk. So it's really not a representative sample. It's a simple, convenient sample. I think Mike and his colleagues had done a nice job with Qualtrics and do quota sampling to match it to in terms of age and sex and some demographics to the demographic characteristics of the census, I believe in 2010. But our goal here was to oversample specific groups with the idea of trying to see if we can do some permutations of comparison, let's say pairwise comparison or different comparison across different groups to see if we can generate some hypothesis about what may be going on. So prior owners, those who already had a firearm, but also purchased a firearm because of concerns due to COVID during the pandemic. New owners with household firearm ownership. So those who did not have a firearm themselves, but they bought a firearm, but somebody in a household already had a firearm. New owners without household firearm ownership. So these are individuals who were not living in a firearm owning household. They were not owner of a firearm, but they introduced a firearm, if you will, into their household. I think that's a really interesting group. Prior owners without purchase, so those who already had a firearm or had firearms, but they didn't buy any new one. Non-owners with household firearm ownership and non-owners without household firearm ownership. So we decided to focus on these groups specifically to really see if we can generate some hypotheses or think about some of these patterns. And we ended up with 1,105 because of some exclusions that we had to make. We had included some validity check, if you will, in the survey to see if they are truthfully, to the best of our knowledge, answering the questions, some other oddities and some of the answers that you always get in a survey. And we ended up about 1,105 respondents in the final analytic data set. And this is just a small snapshot of some of the 4 tables that you see in that article, just to give you a sense of what we're talking about in each of these 6 groups, and broadly in terms of age and sex distribution. And as you see, this is not like a match, for example, for the underlying population, but this is a distribution that we get in this sample. So in terms of some of the findings, as I mentioned, these are just simple descriptive percentages, but those that potentially might be interesting to delve a little bit deeper in the future, both in qualitative research and quantitative research, to understand it better. So here are 2 of the 6 groups that I have highlighted for you. New owner with no household ownership. Again, these are individuals who are introducing firearms in their household, at least at that time. And then non-owner, no household ownership. And you can see some stark differences between them. I haven't added all the confidence intervals around this, but you can see that when you look at the point estimates here, that there are sharp differences between the 2 groups that are notable, and some of them concerning, and some of them informative in terms of potentially what some areas of intervention in the future or foci of focus might be. I mean, you can see here, for example, that a greater proportion of those new owners than non-owners had children, or they had stocked up on some of the things like first aid supplies and pepper spray. And when we talk to other colleagues in gun violence research and firearm injury research, the idea of understanding and better elucidating ways that people have these perceptions of risk is really, really important. We don't know really much about it. We should increase our knowledge of it. Individuals and households that are very concerned about issues of theft, robbery, and crime, we can ask them about how, whether they have purchased a firearm, whether they store a firearm, but I think that would be incomplete if we didn't also ask them about some other safety measures that would really contextualize the findings that we have about firearms. Of note, when they were asked whether they lived in a firearm owning home, you can see almost twice, exactly twice actually, the proportion of those who were non-owners among new owners had actually lived in a firearm owning home, suggesting potentially, without trying to overinterpret the results, but suggesting that maybe they also had some familiarity with firearms before, maybe when they were growing up. But these are just some of the examples from that paper, and I didn't want to put all the tables here. That would be too much. But just as some summary of some of the interesting findings. This is another slide comparing 3 of those 6 groups when it comes to firearm training and storage. So new owner, no household ownership, prior owner with purchase, prior owner without purchase. And this was a quantitative survey. It's a survey that doesn't go into depth like a focus group or a rigorous qualitative research to really understand what are some of the reasons are, what type of training people have received. But you can see that, for example, in terms of training, official training or formal training in terms of firearm handling and safety, the proportion of those who say they had ever been trained is consistent with what we had found at the national level. We had done a study earlier using National Firearm Survey that was published to look at the extent of training, firearm training among individuals and whether suicide was a component of that. These numbers are consistent with that. So in terms of sanity check, if you will, or validity check, at least qualitatively, they make sense to me, the first row. But since January 1st, that was interesting because 16% of new owners mentioned that they had received this training. Again, this needs to be followed up with some detailed questions and probing about what type of training, in what setting, what was the component of that. The storage, just like the study that Mike and colleagues had done, we found the same type of findings in that we found it to be a little bit all over the place. That's like the best way I can describe it. Some individuals had made it more stringent. Some individuals had made it less stringent in terms of locked or loaded. it worked in both directions. The rationale for that ranged from things like preventing child access to reducing risk of suicide, toward making it more stringent, but to prevent robbery and theft, for example, to make it less stringent in terms of safe storage, which to me is not shocking. It makes sense because the concept of safe storage is a very complex concept. As you talk to different constituents, different stakeholders, different community organizations, different groups, safe storage of firearm means very different things to them. And even for the same entity, for the same group, for the same individual, safe storage may depend on the context. Safe storage, it would be very safely stored if it was for self-defense, if it was loaded and unlocked, but it would be very safely stored if it's, if kids are around or maybe a suicidal teen or a teen who is in crisis. So it's a complex, contentious issue. And I'm here showing you some examples of the work that we have done in the past, working with different groups. We worked with Jen Stuber, our colleague here, who Mike knows well, to do some of these work in gun shows, for example, across Washington state, to see what are the approaches that we could take to really understand whether they can change their storage behavior right there as they are in a gun show. We've worked with Seattle Children's to look at community events where we provide lock boxes or trigger locks and other forms of devices and ask them about their preference for what type of device do you prefer for storage and for what context and when and where. And we have evaluated them, and we have also done systematic reviews of interventions to promote safe firearm storage. It continues to be a lively debate in the field. We need to have more information about this, but I just want to provide you with some example of the work that has already been done. Mike and his colleagues also have done really nice surveys and other works related to storage, concept of storage, especially in the context of suicide. So in conclusion, I think we have some slim but emerging evidence on characteristics of new purchases or owners. I think it's up to you all and us to maybe understand this better. The pandemic is not over, unfortunately. Maybe by next year or so, depending on the vaccine. I know that the Vaccine Advisory Committee of the FDA is meeting this week to approve the Pfizer vaccine, but it's not over. It's not going to be over for a while. And really trying to understand how it may have impacted at least some of these intermediary variables before we can make a really clear opinion or judgment about firearm injury and death. Still, it would be very helpful to understand these mediators. I think there are lots of opportunities to look at things like perception of risk and safety associated with firearm ownership and storage, to really focus on short-term crisis interventions to see how they can be deployed and employed during this time, considering the limitations that we have, and diverse means of creating space and time between firearms and those who may be at high risk of harm to self or others. To give you an example, we're working with Dr. Amy Betts of University of Colorado on an NIH grant to really examine the usability of these maps that some of you may have heard. Some states have these maps like Washington, Colorado, Maryland, where law enforcement entities or gun retailers or others say that they are willing, those who say that they are willing to store firearms temporarily for people who might be in crisis. They are depicted on a map, and that map is freely available, publicly available to individuals. And some promotion is done to promote awareness about the presence of this. So if individuals, they feel like at the time of crisis, mainly is for suicidal crisis, but it could be also for homicidal crisis or other concerns, they can voluntarily temporarily store their firearms. It's attractive because of the word voluntary in that. We have the do not sell list in Washington state. That's a policy that we have in Washington state. Washington became the first state, and I think Virginia recently became the second state where voluntarily you can ask your name to be added to the list of do not sell when you feel like there is a crisis going on. And then there's ERPO, extreme risk protection orders, as you all know, the laws, so-called red flag laws that have been in place as of today, I believe in 19 states and District of Columbia. And so the question comes up, what about the use of ERPOs during this time? What are some of the opportunities in terms of petitioning the court to remove a firearm, but during this time of social distancing, the use of internet, can the petition be done via phone, via internet, without in-person presence in the court, et cetera, just like domestic violence protection orders. There is a large body of work that, ongoing work to try to decipher that. And then lastly, promoting awareness about available resources, including training opportunities. I don't know if you saw this, but when I saw it on NPR, it was really interesting. This gentleman is talking about this idea of an office hours for teaching new gun owners about the ABCs of guns. I don't know about the efficacy of this approach. I'm not taking any side, whether this is effective or not. I'm just providing this as an example of individuals within the gun owning community who really understand that some new gun owners have been added to the pool, and they may not know, or they may not have sufficient time to actually get the training that they need. So they have created this office hours, if you will, online for people to ask questions or understand some basics about firearms. In the next maybe 2 minutes or so, I will just end with this and then open it up for questions and discussion. I think for many of you who work in this field, or those of you who may not even work in this field, lots of questions come up when we think about this, about maybe inferential designs that we can use in the future to really examine the, certain risk and protective factors and their relationship with firearm injury and crime, or qualitative research that looks at some of those intermediary variables. I think the fluctuations in terms of all that happened in 2020 provides an opportunity potentially to look at how things changed in relation, almost like time series, in relation to each of those events. I think that's something that potentially we can use in research to really understand the patterns a little bit better. It was a very chaotic year with lots of overlapping windows, but I think there might be opportunities to decipher some important points. The concept of risk and benefits and the perceptions of those at this time is especially important because of all that has transpired in 2020. New modalities and new ways of training, promoting awareness about safety should be created, and we should think about how to frame this in terms of who is the messenger, what is the message, to really make sure people understand that when they bring or introduce a firearm to their household, they really understand, especially in this time, what are the risks and benefits related to those, especially when people talk about their concern about crime, when they talk about their concern about supply chain disruptions, when they talk about their concerns about health, when they talk about their concern about the economy. And lastly, how could firearm retailers, local governments, and departments of public health contribute? This is in King County. The Lock It Up program that some of you may have heard about has been in place for some time. To their credit, really, our colleagues in the Department of Public Health have done an outstanding job to try to partner with retailers in our region on these, lock boxes and other forms of safety device that, people who go there, they can get a discount on these devices if they mention the Lock It Up program and its vision, which is really promoting safety and making Washington, especially King County, a safer place. So it's 9:42 here, Seattle time, and maybe I will stop there and ask maybe Mike or Michelle to see if there are any questions I can answer.
Thank you for that. I really appreciate, I think we're all sort of white knuckling our way through 2020. And so hearing you give this presentation that's so firmly rooted in the moment that we're in, I think from my perspective anyway, is just really illuminating and helpful. So folks, if you have questions, I'd love for people to be able to just unmute and ask them, but with so many participants, that's going to get a little bit unwieldy. So I think our best bet is to put them in the chat. If you have questions. In the meantime, while you're doing that, I'm happy to tee up one or two to get us going. But I'd love for the folks listening in to sort of share their thoughts and ask their questions. Ali, if you don't mind, I'll jump in with the first question. which is that, you framed a good chunk of this talk about safe storage, and I know that my crew in particular has invested pretty heavily in this idea. We've done clinical trials on this. This matters to us, but I can't, in the back of my head, shake the fear. And Matt Miller and others have articulated this well, that maybe safe storage won't work from the suicide perspective. If you look at the story of pesticides, safe storage didn't work there. It wasn't until they banned them. Do you have any concerns as we're doing this research on safe storage in the context of new firearm owners and surge purchases, that we might have our eye on a mechanism that might not save as many lives as we hope it will?
That's an excellent point, Mike. I do share those concerns. In fact, I mean, as disappointing as this may sound to many of our colleagues, to our research community, to our advocacy community, the state of evidence for the relationship between safe storage and reductions in firearm injury among adults is not very strong. Compared to youth, which we do have strong evidence. I always cite David Grossman's paper in JAMA as probably the gold standard, one of the best studies ever conducted on the relationship between youth, both accidental shootings, unintentional shootings, and suicide, and some other studies. For adults, we do have some conceptual model about, as you know, about delay in terms of access to means, the way that, Kathy Barber and Matt Miller have nicely depicted. But in terms of the empiric evidence for it, we really, in my opinion, don't have good evidence for that. It may work, but we really don't have solid evidence in that. The lethal means canceling and the effectiveness of that at the ecologic level, as you nicely described, has been established at the ecologic level, the UK example, the Sri Lanka example, and others, and as you said, some drastic measures. That has been established. But the individual level, in fact, when you think about lethal means counseling, for example, on issues of safe storage, I can think of only one or two papers in the literature that have touched on the adult population and look at really the final salient events. One of them came out of Kaiser, Colorado by Jennifer Boggs, which was her dissertation project on lethal means counseling, its effectiveness at the individual level on reduction of suicide death, that came out last year. But absolutely, so going back to your comment, Mike, I do share that concern. I do believe that in terms of, I think it's effective and it would be worthwhile to promote safe storage, at least as it is concerned with youth population, but in terms of adults, we really don't know whether that mechanism in terms of the reducing accessibility, in that it's available, it's in the household, but it's accessible or not accessible. I'm not sure if that's necessarily the right mechanism. So I completely agree with you. And that, I think, highlights again the idea of not forgetting about the entire spectrum of tools available to us to potentially reduce the risk of suicide. So as I mentioned to you, the maps I described to remove firearms, ideally all of them from the household, at least for a temporary period of time, or ERPOs. Two very different mechanisms, but they do get at the point that you're mentioning, which they're not about storage, they're about entirely removing firearms from the household. So that's an excellent question, a very difficult one for the field as a whole.
We just had a question coming on the chat from Keith asking, are Americans buying products online more than ever before? Do you think this is occurring for firearm purchases? Does this hinder our ability to promote safe storage or any other public health interventions? And if so, how can we respond?
That's a good question, Keith. I don't know if you're mentioning firearm purchases in terms of like how they are buying the firearms. I don't know. That's a good question. I haven't seen, I haven't looked for evidence of that. There might be something available, or people may know. I am not sure if it necessarily hinders our ability to promote storage, safe storage, or promote just safety around firearms. I don't think that, if that's the question, the way that they are purchasing it necessarily would have direct bearing on that. I'm confident, based on some of the work, for example, our colleagues have done here in public health, with different ways of promoting awareness with flyers and different ways of approaching the population here, that you could actually have a really good reach of those messages. Behavior change is difficult, as we have all seen with regard to masks and other things that we have been talking about in terms of public health awareness and approaches. But we have had successes, maybe not at large scale, but at the smaller scales in different communities, as I mentioned, gun shows, communities of individuals in rural areas, those who have been parents of young kids, with certain subpopulations, regardless of how they purchase firearms. I think they've had some successes. Those efforts I mentioned to you, like the ones that Seattle Children's have held and the gun shows, they were all before COVID. And so it will be interesting to see when we can roll out some of those programs during the COVID era and how people will react to it, and whether what we see post-COVID is going to be different from what we saw before COVID. I think that's a fantastic question, and we just have to wait and see.
While we're waiting on other questions to come in, I have one more I would throw your way. And that's it. One of the things that strikes me, actually, you know what? Someone else asked the question, so I'd rather the audience, because I get to talk to you afterwards. So we have two more that come in. One from Alana asking, given the criminality of improper firearm storage practices, has this field of research addressed concerns regarding the validity of responses collected via self-report measures?
It's a great question, Alana. So I can answer that question many different ways, but let me just say that when you mention the criminality of improper firearm storage practices, just make sure that we're on the same page. So there are certain laws in certain states that require firearm owners to store their firearms in a certain way. That is very heterogeneous. That varies from state to state. Many of them are labeled or known as CAP laws, as you know, which is the Child Access Prevention laws. Not all of them are CAP laws necessarily. Like Washington State Initiative 1639 that went into effect last year. If you look at the tiny small font of the statutes or law, you can see that it's a broad universal requirement for people who are gun owners to actually keep it in a locked container. It doesn't necessarily say it would have to be in the presence of a child. So people as we work on, research and firearm policy, sometimes we call it like Washington CAP law, but it's just for ease of understanding. So going back to your question, the field of research on this, Alana, in terms of how people store their firearms is universally plagued with the fact that it's almost always self-report. And I say plagued, maybe it's a strong word. What I'm trying to say is that rarely do you see a research project that uses like direct observation to see how people are storing their firearms, and for obvious reasons, because it's really hard to do that. And then in terms of the collection of data, mainly it's intermediate variable, and that systematic review we did. All of the outcomes were self-reported outcome, because we didn't find any study other than one, which I will describe shortly, that actually did direct observation. The main one that I have found that was nicely done by David Grossman some years ago in Alaska, they actually made direct observations. They went back to houses to see how they are using their gun safe, but that was gun safe. And they were trying to really measure to see people whether their behavior has changed or not. So issues of self-report, social desirability bias, issues of recall bias, misclassification of outcome especially is very common in this area. Now you could use techniques to ask some of them and gauge the degree of misclassification and demisclassify, if you will. So asking questions in the survey that is about other things that have nothing to do with your intervention to see whether they changed or not. But that's as far as it gets to my knowledge.
We had one other question coming from Josh asking, what effect or research has been done regarding safe storage, licensing, or permits for purchasing ammunition as opposed to firearms? While California's ammunition background checks has not been implemented due to an injunction, some states such as Connecticut have this policy.
What effect or research has been done regarding safe storage, licensing, or permits to purchase as opposed to firearms? Can you clarify the question, Josh? When you mean as opposed to firearms?
So I'm not sure if you can actually hear me, but this is Josh. Okay. I actually work in healthcare here in Connecticut at a community-based organization. We don't directly deal with firearm injury prevention, but we're certainly hearing a lot from a lot of patients that they've been purchasing firearms. Obviously, a lot of people are concerned about safety and security. One of the things that Connecticut recently implemented, and there's been a number of policies implemented following the Sandy Hook shooting, and this is less focused on having to do with suicide prevention, but more focused on theft and child access. You still have to have a permit to purchase a firearm, but the same now applies to ammunition. And if you, in other words, you can't just be buying ammunition at Walmart. You need to have a permit, and if it's a caliber that is associated with a handgun, you have to have a handgun permit as opposed to a rifle permit. So they're trying to make sure that if somebody is not licensed to have a firearm, they can't also obtain ammunition.
Thank you. That's very helpful. Yeah. So the emphasis in your sentence was purchasing ammunition as opposed to the firearm itself. Sorry, I missed that. That's a really good point, Josh. No, to my knowledge, again, I mean, I'm saying it's a take. I haven't seen policy research really trying to examine the effectiveness of that specifically for ammunition. I think it's a fascinating question, something maybe in the future, if there is, if it's a feasible study to do. Permit to purchase and licensing is a hot area of research, as I'm sure you know. Daniel Webster, Cass Grifasi, and our colleagues at Johns Hopkins have done a beautiful job studying those and really teasing apart different components of it. They are working on issues like fingerprinting and others. It's an active area of work as it relates to ammunition, and it's the effectiveness of that approach. I haven't seen any paper looking at the effectiveness of that approach.
So folks, we only have a couple minutes left. I don't see any other questions in the chat, but I had one quick one, which was just that I'm wondering, with your survey that you described, are you equipped to look at whether there's variability in the purchases during COVID era geographically? And so I just say this having spent the last decade living in Mississippi, and it's the population's different. Gun ownership means something different there. And you might wonder whether the patterns of purchasing during 2020 might vary in the same way from culture to culture or state to state.
That's a great point, Mike. I don't think we have looked at it. I need to look back at the data set to see what level of geographic variability and granularity we could look at it. Again, it's a convenience sample, but that's a fantastic question. I will take a note and see if we can look at it. With the sample size of 1,200, may or may not be able to look at it, some of them exploratorily. But I think that's wonderful, because I am pretty sure that there is some sort of moderation or effect modification of some of these salient events on firearm purchase by geography, by region. As I mentioned last time I checked background checks for our state in Washington, it was really, I mean, these numbers are really, if the audience, I'm talking to the audience here, if you haven't done it, it's a fascinating exercise. If you look at it and see, by month, what was it, the background checks, for example, in September of last year compared to September this year and all that. So I think it's really, really interesting to look at it. But I will look into that, Mike, and we will get back to you to see what kind of opportunities we have to look at geographic variability.
All right, thanks.
Thank you.
Well, thank you everybody for tuning in. We are sort of at our limit here, but I'll only speak for myself, but I'm sure folks would echo. I really appreciate the presentation and the thoughtful answers to the questions. This was a really illuminating and interesting talk. Thank you.
Thank you for having me.
And Ollie, I believe that we are taking like a 15-minute break before the roundtable for some folks. And so for those of you coming into the roundtable, we'll circle back in at around, I guess, what time is it now? Around 1:15 Eastern time.
Yep,
and I'll leave the room open. Okay, great.
Great. Thank you very much. See you then.